In this part of the test, you will hear a conversation between a diabetes nurse specialist and a patient, Mr. Frank Miller, during a routine follow-up appointment. Now you have 30 seconds to look at the notes.
Good morning. It's great you could come in. Let's take a closer look at how things have been going since your last visit. I see here that your last HbA1c reading came back at 7.8%. How have you actually been feeling over the last couple of months?
Well, I'm genuinely trying to stick to the plan, but to be totally honest, I'm not great. I find myself constantly thirsty, and the worst part is I'm getting up to use the toilet at least 3 times every night. That sleep interruption is just making me feel absolutely run down.
I completely understand how disruptive that must be. That frequent need to urinate at night is medically termed nocturia. And yes, when you combine that with the thirst, it's a pretty strong indicator that your glucose levels are consistently running too high. Have you noticed any other changes, perhaps with your appetite?
Funnily enough, yes, I've definitely had an increased appetite, actually. I feel like I'm eating way more than I usually would, but I still feel hungry a lot of the time. And I still get that momentary dizzy feeling if I stand up too quickly, like from a chair.
Okay, that's important to note. And just quickly, did you manage to do a quick check of your feet this morning?
I did. I noticed a small patch of hardened skin right on the sole of my left foot today. It's not sore or anything, but I have to say it looks a bit concerning.
Thank you for being so thorough and pointing that out. We'll get that checked properly. Now let's focus on the medication side of things. You're currently taking metformin, is that right?
Yes, I take 1,000 milligrams daily with my evening meal every night.
And are you taking that dose consistently, morning and evening, as prescribed?
Most of the time, yes, absolutely, but I've been occasionally missing my morning dose. It just completely slips my mind when I'm rushing out the door. When I do miss it, I find I tend to get quite a bad headache and feel sick later in the day.
That makes perfect sense. We really need that consistency. Given the high HbA1c and all these symptoms you've described, it's clear we need to significantly adjust your approach. I think adding a second agent is definitely warranted at this point. I'm going to consult with the doctor this afternoon about initiating you on glycoside.
Glycoside. Okay, I'll make sure I try my absolute best with that.
Excellent. Now, let's quickly review your diet. What is your biggest challenge in sticking to the dietary advice?
It's mainly avoiding sugary drinks when I'm at my grandkids' parties, you know? Everyone else is having fizzy pop and cordials, and it's tough to be the only one to say no.
I hear you. Those social situations are tricky. And what about exercise? How's that going?
I've been walking for 40 minutes most days, actually. I'm really trying to keep it up.
That is absolutely fantastic. We'll certainly keep that excellent exercise routine going. I will also be sure to refer you to a dietitian to help you specifically navigate those challenging social situations and structure your daily meals better. Additionally, I want you to start checking your blood glucose levels. I'd like you to check them 1 hour after your main meals to see the direct impact your feed choices are having.
1 hour after meals. Got it. I can do that.
Wonderful. Finally, let's get your next follow-up scheduled. I'll plan to see you again in 4 weeks.
4 weeks. Perfect. Thank you very much.
In this part of the test, you will hear a conversation between a general practitioner, GP, and a patient, Ms. Clara Davies, during a post-operative review 1 week after a laparoscopic cholecystectomy. Now you have 30 seconds to look at the notes.
Morning, Miss Davies. Do come in, have a seat. So, we're doing your 1-week checkup today after you had your gallbladder out. Is that right?
Morning. Yes, it's been a week already, hasn't it?
Brilliant. Just to confirm, you had a keyhole procedure, a laparoscopic cholecystectomy.
That's the one. Just the 4 tiny cuts.
Fantastic. Now, how are you feeling overall? What's your biggest niggle or main concern right now?
I'm managing, thanks. The main thing is this soreness and a feeling of real tightness across my tummy, especially if I move suddenly. It's not stopping me, but it's just constantly there.
Right, quite a persistent ache then. If we use the 0 to 10 scale, what would you say is the worst your pain has been in the last 24 hours?
Oh, the worst is probably only a 4. It was much worse right after the operation, obviously, but it's definitely calming down.
That's a cracking reduction in pain. Have you had any other unusual aches? Sometimes people get a bit of referred pain.
I did. For the first few days, I had this really sharp pain that shot right up to my right shoulder. It's nearly gone now, but it was a bit of a shock.
That's absolutely standard. Don't worry about it. It's just the gas they use during the procedure shifting about. Now, is there any specific movement you're struggling with?
I really can't manage any twisting or bending movements at all. I have to pivot my whole body when I turn.
That's spot on for this stage of recovery. Let's have a quick look at the wound sites, shall we? They look lovely. All 4 small incisions are clean and dry, no sign of infection or nasty bruising. Very positive. So, what are you taking for the pain these days?
I ditched those strong tablets and now I only need paracetamol.
How frequently are you popping them?
Roughly 3 times a day, just when that soreness starts to become annoying.
Perfectly sensible. Let's chat about diet. How are you getting on with your meals?
I started very gently. I've successfully managed to reintroduce low-fat meals back into my diet, mostly just plain rice and chicken breast.
That's brilliant. And what are you making sure you still steer clear of?
I'm strictly avoiding dairy products and absolutely anything fried, just to be on the safe side, you know?
Very wise indeed. Now, your activity level. No heavy lifting yet, but what level of activity have you been able to manage?
I've been doing a tiny bit of dusting, but mainly just short walks around the house a few times a day, just as the hospital advised.
That's absolutely ideal. Keep those little walks going. You mentioned the tightness and soreness. Remember that the referred shoulder pain should resolve completely over the next week. That's a sign the gas is fully dispersing, so honestly, don't fret about it. We'll get you booked in again in 3 weeks.
Thank you very much.
Part B. You hear a geriatric nurse explaining a new guideline regarding fluid management for patients with early-stage dementia. Now read the question.
Good morning. A quick briefing on the new fluid intake guidelines. Historically, we encouraged patients with early-stage dementia to sip water throughout the day. However, monitoring compliance was inconsistent, leading to fluctuating sodium levels. The revised protocol is clear. Fluid administration must now be paired directly with scheduled mealtimes. This creates a predictable routine that patients can more easily follow and allows staff to accurately document intake, which is the primary driver for this change. While spontaneous sips are fine, they are not to be relied upon as the main source of hydration.
Question 26. You hear 2 nurses discussing a patient, Mr. Evans, during a shift handover. Now read the question.
So, regarding the patient in bed 4, Mr. Evans, he had quite a difficult night. His pain levels were noticeably elevated, and he required additional reassurance through the night. The good news is that his vital signs are stable this morning, and he's much more comfortable after his last round of analgesia. However, he's still rather determined to get out of bed and walk to the commode by himself. Now, the orthopedic surgeon has officially cleared him for partial weight bearing, but that clearance comes with a very specific condition. He must be fully supervised during any mobility activities. His actual physical ability isn't the problem, it's his tendency to forget instructions. He doesn't consistently remember to use the call bell and tends to attempt moving on his own, which obviously puts him at risk of a fall, despite having adequate strength. I've documented this clearly in his notes and added a reminder on the bedside chart for the physiotherapist to review his functional strength first thing this morning. Until that reassessment happens, no independent commode visits. He should be assisted every single time, even if he insists otherwise.
Understood. So he's physically capable of limited mobility, but supervision is absolutely non-negotiable for now.
Question 27. You hear a GP dictating notes after a consultation with a young patient presenting with persistent fatigue. Now read the question.
Patient name, Sarah Jones, aged 19. She presented today with a complaint of persistent fatigue that hasn't improved despite adequate rest and sleep. She describes the tiredness as constant, affecting both her physical stamina and her concentration levels during daily activities. Initial investigations have already been carried out. Her routine blood panel shows a marginally low serum iron level, but not low enough to independently account for the extent of her reported exhaustion. Her hemoglobin and thyroid profiles from previous visits were both within normal range. There are no signs of infection, and we've formally ruled out glandular fever as a possible cause. What stands out most in her history is her dietary pattern. She follows a strictly vegetarian diet, but her protein intake is extremely poor. She relies heavily on carbohydrate-based snacks and has admitted to frequently skipping main meals. Instead, she's been substituting meals with commercially available energy drinks, which are high in caffeine and sugar, but devoid of substantial nutritional value. This pattern has likely worsened both her fatigue and her overall metabolic balance. At this stage, my working impression is that her fatigue is predominantly related to nutritional deficiency, rather than any underlying systemic or endocrine disorder. However, to be thorough, I'll order a complete endocrinology panel, including cortisol and B12 levels, to exclude other less common causes. In the meantime, I've advised her to begin a more structured dietary plan focusing on adequate protein intake, preferably through plant-based sources such as lentils, legumes, tofu, and nuts, and to discontinue excessive use of energy drinks. She'll be reviewed in 2 weeks to monitor both her symptom progression and nutritional response.
Question 28. You hear a pharmacist advising a customer about storing a new injectable medication. Now read the question.
This is your new epinephrine autoinjector. Crucial safety information. You must store this at room temperature, never in the refrigerator, as extreme cold can damage the mechanism. Equally important, never keep it in the car's glove compartment. We see many patients do this, but high heat degrades the drug itself. The manufacturer recommends checking the expiration date monthly, but the priority is maintaining the correct temperature range.
Question 29. You hear a surgeon is briefing the theatre staff before a procedure. Now read the question.
Team, we're about to begin a scheduled laparoscopic appendectomy on a 35-year-old male patient. He's otherwise healthy, with no significant comorbidities noted in his preoperative assessment. However, a point of caution. The anesthesia notes mention a history of difficult intubation during a previous surgery. So anesthesia, I'll need explicit confirmation that intravenous access is well established before induction and that all airway adjuncts are ready and available, including the video laryngoscope as a backup. Let's make sure we're fully prepared for any airway challenge. Now, Scrubners, please take note of the revised instrument and swab count protocol. We're implementing the new digital documentation system today, which must be cross-verified with the manual paper chart at every stage, pre-incision, before closure, and at final count. Accuracy in both records is essential, not optional, so please ensure each step is double-checked and confirmed verbally. In terms of surgical focus, the most critical determinant of success for this case will be maintaining optimal visualization throughout the procedure. The appendix, as noted on imaging, is retrocecal and partially adherent, so exposure may be more technically challenging than usual. We'll need careful traction and possibly repositioning of the patient to achieve a clear operative field. I'll rely on the assistant to keep the camera steady and the visualization consistent throughout. Let's maintain full communication, follow the checklist, and keep safety as our primary priority.
Question 30. You hear a geriatric specialist presenting a conclusion about a trial on cognitive intervention. Now read the question.
In conclusion, our trial evaluated 2 interventions for mild cognitive impairment, structured physical exercise, and complex memory games. While both groups showed slight improvements in mood, the key finding was specific to cognition. The physical exercise group demonstrated significant measurable improvements in executive function, things like planning and problem solving, which exceeded the gains made by the memory game group. This suggests that complex tasks primarily improve recall performance, whereas exercise is superior for improving broader, higher-order cognitive abilities.
Part C, you will hear an excerpt from a health podcast featuring an interview with Dr. Anya Sharma, a clinical dietitian, discussing misconceptions and common pitfalls in long-term weight management. You now have 90 seconds to look at the questions.
Welcome, and thank you for joining us. Many people struggle with the frustrating cycle of losing weight only to regain it. What do you think is the biggest misconception behind this pattern?
The major issue is the persistent obsession with the calorie in, calorie out model as the ultimate explanation for weight loss. While it's mathematically sound, it completely overlooks human behavior. Restrictive diets that depend solely on calorie counting create an enormous psychological burden. They turn food into an adversary rather than nourishment, leading to fatigue, frustration, and eventual burnout. Most people don't fail because of a lack of willpower. They fail because the approach itself is unsustainable. That mental strain is what fuels the rebound effect.
So it's not just about what's on the plate. It's also about mindset and external factors. What non-diet elements do people commonly ignore?
Absolutely. We underestimate the impact of factors beyond nutrition. Stress management is crucial, but one of the most neglected areas is sleep. Poor sleep disrupts two hormones central to appetite regulation: ghrelin, which increases hunger, and leptin, which tells the body it's full. When someone is chronically sleep-deprived, ghrelin levels rise while leptin drops, leading to stronger cravings and reduced satiety. Essentially, lack of sleep primes the body to overeat and makes maintaining a healthy metabolism incredibly difficult.
That's fascinating. Returning to diet, what specific food group or source tends to be the biggest culprit in sabotaging progress?
Without question, it's liquid calories. Beverages like sodas, sweetened teas, and even those massive fruit juices are a hidden danger. The body processes liquid calories differently. They pass through too quickly to trigger the brain's satiety mechanisms. There's no chewing, no fiber, and no real sense of fullness. So people end up consuming hundreds of calories without reducing their intake of solid foods later. It's the silent saboteur most diets.
If restrictive dieting isn't the answer, what principles should people follow instead for long-term success?
Sustainability has to be the guiding principle. Extreme diets are a short-term illusion. Instead of cutting out entire food groups, people should aim for gradual, achievable changes, tiny adjustments that can be maintained indefinitely. Think of it as building a lifestyle, not following a program. Something as simple as adding a serving of vegetables to lunch or switching from full-fat to low-fat milk can create long-term progress. If a diet feels temporary or punishing, it's destined to fail.
What's your take on the trendy detox and cleanse movements that claim to deliver instant results?
Those are marketing gimmicks dressed up as health advice. The problem with detoxes and cleanses is that they promote an all-or-nothing mentality, hyper-restriction, followed by rebound overeating once the cleanse ends. Physiologically, your liver and kidneys already handle detoxification beautifully. There's no need for juice-only diets or starvation regimens. These fads actually damage the body's metabolic rhythm and encourage disordered eating behaviors.
To wrap up, what's the one lasting mindset shift you'd like people to embrace?
The key shift is moving away from obsessing over the outcome, the number on the scale, and focusing instead on the process, the consistency in daily habits. Hydration, regular movement, adequate protein, and quality sleep. Those are the pillars. When those habits become routine, results naturally follow. The scale is just a reflection of your consistency, not your worth or effort.
Extract 2. You will hear an excerpt from a medical lecture given by Dr. Julian Hayes, a gastroenterologist, discussing the emerging role of the gut microbiome in regulating mood and mental health. You now have 90 seconds to look at the questions.
Good morning. I want to talk about the gut-brain axis, the two-way chemical and neurological highway that links our digestion to our mental state. For too long, the gut was seen purely as a digestive organ. We now know the microbiome, the billions of bacteria residing there, plays multiple, indispensable roles. Its most fundamental role is not just digestion, but acting as a critical barrier that lines the intestine, preventing the entry of potential pathogens and toxins into our systemic circulation. The communication between the gut and the central nervous system is what we call the axis. While many chemical messengers are involved, the primary route is the vagus nerve, the longest cranial nerve, which sends signals from the gut directly to the brainstem. This explains why severe gastrointestinal distress can instantly affect your mood. Now, the bacteria influence this axis by producing metabolites, primarily short-chain fatty acids, SCFAs. These SCFAs, such as butyrate, are key. They don't just help with digestion, they are vital for regulating the permeability of the intestinal lining. If this lining is compromised, often referred to as leaky gut, the immune system is constantly put on high alert. When we intervene, we often discuss prebiotics and probiotics. A key distinction is their function. Probiotics involve introducing new beneficial bacterial strains directly into the gut. Prebiotics, however, are non-digestible fibers that act as fuel for the beneficial bacteria already residing there. Prebiotics are often seen as the more sustainable long-term intervention because they support the individual's unique existing flora. Speaking of that compromised lining, a significant consequence is when the tight junctions break down. This allows bacterial components, known as endotoxins, to leak out. This leakage of microbial products triggers a cascade of systemic inflammation, which can then cross the blood-brain barrier and contribute to symptoms of anxiety and depression. So what is the best clinical intervention? While specific probiotic strains are useful for certain conditions, the long-term foundational advice must be dietary. Instead of expensive supplements or restrictive tests, clinicians should focus on supporting patients to adopt a diverse plant-based diet rich in fibre. That diversified fibre is the true gold standard for cultivating a healthy, robust microbiome.
Thank you for your participation and support. Kindly review your answers and indicate the number of correct responses you achieved in this test. We also welcome your valuable feedback or suggestions regarding our channel and videos to help us improve further.